back our hostess with the mostest, Dr. Woodward, talking about, and Shorty played her song earlier today, laser myectomy.
Okay, just getting the slides up. Everybody enjoy the meeting. I'm supposed to talk, now that Dr. Blood is gone, I'm supposed to talk about laser surgery because it bleeds very little. But before I did that, I want to say thank you to my patients who are here and have participated in this lecture because I have videos of quite a few patients from the past. It's mostly an anecdotal talk. I've got one surgical video and I will not show you a lot of blood. I just saw his slides yesterday and I said, I don't know if you want to show all that. And he said, I think it's too late to change it. We said, okay. So anyway, you all may be familiar, we heard about May syndrome. Bruegel syndrome was first described in the 1600s by the Flemish painter. They thought these people were witches and they actually killed them. And so that's when it was first described in the 1600s. You'd heard a couple times about Alan Scott, the creator of oculinum, which became Botox. And this picture was us standing right here when he came to speak at Duke. And I really wanted to meet him because I'd always heard this story, this crazy story that he created oculinum Botox and he licensed the patent to Allergan for only $75,000. I'd heard this from several people and I felt really bad for him. I thought, my God, this company's made billions of dollars off of him, and I was really embarrassed, and I went to it and I thought, I just have to know the truth. I felt really tacky, but I was okay, I'll be tacky. I said, Dr. Scott, is it true that you licensed that patent for only $75,000? And he laughed and he said, no, dear honey, I made $8 million. And that was back in the 80s. I felt so much better for him. Such a nice guy, and he didn't accuse me of being tacky. So as you've learned, the whole the blepharospasm is so complicated because it's not one spot in the brain. As you've learned from all of our speakers, it's all over the brain. That's why the plasticity is so complicated to try to fix. It's so global around your whole brain. And all the treatments we've tried, if it's been sensory, it's been tried from every kind of drops to plugs, acupuncture, relaxation techniques, it's been tried. You just heard about two different types of central treatment, DBS and the TMS. And drugs, like Dr. Scott was talking about. So every kind of pill has been tried. We're not skipping anything. It's all been tried, and it's very difficult to get anything to work. So I just wanted to throw this in. This is a talk that I did with my dad, who just showed up. He's a neurophysiologist. He has over 500 publications, 12,000 citations, top 1% of doximity researchers, and he helped me construct this study where we took some of my patients pre and post Ritalin, methylphenidate. We videoed them with a concurrent reading of their EMG, and you can see here's a patient, and you can see his voltage was at a certain level and his eyes are tight and he can't see well, and then we gave him a first grader's dose of Ritalin, just 10 milligrams, what you give a 7-year-old kid, and watch what happens. Here's the voltage kind of high, and then we did it again, and look, his eyes are open, and look how much the voltage drops. That's just 30 minutes after 10 milligrams of short-acting Ritalin. We don't know why it works. It's kind of counteractive to some of the other drugs, and if neurologists have patients on medications, I don't want to switch them around. I just have a lot of patients who really like this, and we piloted 7 patients in the study, and only one person didn't see an improvement on the EMG, so we could see that the voltage actually went down. Here's another patient of mine. You can see his voltage is kind of high there, so he's going to go. He's got a chin-up position, and his eyes are really tight. And then after his methylphenidate, his eyes are open, and you can see his voltage actually drops. So that's something subjective and objective. And it lasts about 4 hours. I tell patients, please don't abuse it. Take it only if you're going to drive or have a focused task that's going to last about 3 or 4 hours. And there you can see the drop. So this is another patient whose voltage is very high, tight eyes, and then afterwards his voltage drops quite significantly, and you can see his eyes are more open. So we try to control the dose. The problem is sometimes patients like it so much, they want bigger and bigger doses, and we really don't like to do that. So we try to keep it sort of limited, but that's just one thing you could consider. So the conclusions are it works in most people, not everybody. And then there's other treatments that are neurectomy, that's cutting out the nerves. This has been done since the 60s and 70s, and it does work. It has some complications of not being able to close the eye, ectropia, and different things like that. There's 5 nerves. We try to knock out some of the nerves that are going to the eye. None of these treatments are great. We'd much rather see people get the treatments from the neurologists that are curing the problem, the brain, not just the muscles, the eyelid, but that's what we can do as oculofacial surgeons. So another way to treat this is to knock out the muscles. So different ways to do that, with an injection or with surgery, like Dr. Blood was talking about. And so we've got, there's two ways you can knock it out. Actually, the toxins are more neurectomy than they're myectomy, but I included them in this section. Doxorubicin knocked out muscles. Dr. Dutton published that a few years ago. It didn't work that well because it also damaged the skin. Some people have tried ricin. And then surgery, limited myectomy, extensive myectomies, and that's what I'm going to talk about. You learned about the 9 different neurotoxins that we have available, and I've worked with every single company except for the 2 that aren't released yet. And so the myectomy removes the muscles around the eye, basically so you just can't blink as hard. We take out, there's limited where you're just taking out the orbicularis, which is the sphincter muscle that goes right around close to the eyelashes. And then the more extensive myectomy is when you take out the corrugators and that are above the eyebrow, and the procerus, which is in the smack in the center of the forehead, and that leaves some pretty unsightly scars. So we really, I don't enjoy doing that surgery. Rick Anderson was famous for publishing it. And then this is some of these beautiful anatomical drawings came from our dear anatomist from New York, Dr. Jelks, and he really did these drawings that explain it so well. So this was first described in the 50s, where we just knock out the pink muscle, and the more extensive is knocking out the yellow muscles like I described. And Dr. Anderson described it. And it's got its risks. It's not perfect. It can be asymmetric, can have scarring. Your Botox may hurt more afterwards, can change your prescription for your glasses. But I just wanted to share with you, I've done this for years, and I think I've only had 2 patients tell me that it didn't do any good. Everybody seems to get some kind of results out of it. It's not perfect. You're still going to need your Botox, still going to need your medications, but this is the kind of thing that we would see. So here's a patient. This lady was just kind of funny. Is the volume up? She describes her past. She's a week out of her myectomy.
First hour and a half to 2 hours in the morning, there's no problem with my eye. After about 2 hours, dryness begins, even though I put tears in my eyes constantly throughout the day. This droopy eye, it starts shutting. If I'm on the golf course and in wind and sun, I have a devil of a time. I can't see the putt, I can't anything, and by mid-afternoon, the left eye is totally shut on me and remains such until the next morning. And that will just about do it. My life is in ruins right now, and Dr. Woodward is going to help me get it back together.
Okay. So then this is a little bit of surgery. I'm not going to show you much blood. Oh, it's going to go. Oh, darn, it wants to show the whole thing. God. Can you forward it a little bit? Oh, God. It doesn't, I tried to cut it. Okay, well, here, this is enough. The laser cuts like a knife of light, so we can remove the skin and the muscle with very little bleeding. You can see this is not bleeding. We protect the eye with a little shield, and then we advance the tendon a little bit, and that's. I'm just going to show you this little bit. Like, that's enough, no blood, okay? And this is her afterwards, 1 week later.
So how has the surgery helped you?
How has it?
Yes.
Oh, it's restored my life. I will be able to drive after dark again, I think. I'm pretty sure I haven't driven in a week, and my eyes are not closing on me. I'm not bouncing off the walls at home or anywhere else, and I'm going to be able to play golf much better, because it's hard to play when your eyes shut on you on the backswing and you whiff the ball. It's wonderful.
Close your eyes.
Okay.
Good. Close all the way. A little tight. Good. Want to say something else? Go ahead. Open. So you feel that your quality of life is improved just this week?
My quality of life is improved 100%.
There you go.
Dr. Woodward is a dear. She's literally saved my life. It's giving it back to me. I can be able to go to Europe anymore. I can go walk out in the woods, which I love to do. I can do anything. And heretofore, for 3 whole years, I've not been able to do anything but limited activities.
She just cracks me up, doesn't it? 7-month result. You can see this patient on the upper right. This was her before surgery. Here she is after surgery. Dramatic difference. And that's 7 months after her surgery. 90% improvement.
I can read better. I can, kind of drive, better.
So you can see her result. Here's another one. This is 4 years after.
So how long ago was your myectomy operation?
It's been 3 years.
And how did the myectomy operation improve your quality of life?
100%.
100% back at that time?
Yes. Or
You can
I
see
was,
improvement. And I don't know what the
taping my
pre-video. Oh,
eyelids
there's a
up with
pre-video. He couldn't
Band-Aids
open his eyes
and
at all.
Still receiving Botox.
Just at all. He was running around with
every 3
tape
months.
on his
We've
eyes.
been doing that for over 2 years.
He couldn't be here today, but he'd be happy to talk to you.
I
Still
think
see
it was
him.
4 years.
Here's a
How did the
7-year
myectomy surgery help your eyes?
post-myectomy.
Wait a minute, I'm not sure.
When we did your eyelid surgery, we did
Oh, yeah, that helped
she remembers that
tremendously,
surgery.
yes, because I couldn't keep my eyes open at all. I'd take 2 steps and my eyes would close completely, and I'd have to take my thumbs and pull my eyes open to be able to see and all. And I went like that probably 3 months or more before I've had the surgery.
And here's another patient who also had deep brain stimulation. He had both
How many years
procedures.
ago was your myectomy surgery?
I think his wife had to speak for him.
2012, almost about 10 years ago. And where do you think you'd be now if you hadn't had that surgery?
Like I said, we were gonna see, man.
What was it, you said you'd be blind?
I think he would be blind. I think he would not be able to drive. I think he would have his eyes so tightly closed he wouldn't really be able to see at all.
So it was nice his wife spoke up for him. So, and then this is a patient who also had slings for apraxia at the
How long
same
did you have
time as the
blepharospasm?
Probably 3 or 4 years.
Not too long. And
So
how
you
did
can
the
combine the
surgery improve
operations. I'm going to cut that one off. And some people are not candidates. This is a patient I've injected with botulinum toxin for many years, and I never really thought she needed surgery, so I wasn't going to push it. I'm like, you're just good the way you are. So not everybody is a good candidate for surgery. She was doing fine with toxin. We
And
just
how
left
many
her
years
with
have you
that.
had blepharospasm?
I'm going to cut that off. We're short for time. So there's a lot of publications on the procedure. I definitely think it works. Is it the perfect cure? No. You're going to need Botox afterwards, and the Botox might hurt a little bit more because of the scar tissue, but it is definitely something that helps in addition to all the other therapies we have. Problem is Medicare doesn't pay for it. They used to pay pretty well, and then it's gotten down to the point where they pay actually zero. So I don't even ask them anymore. I won't spend any more time on the phone. We just bill for a regular blepharoplasty with a ptosis repair and are happy what we can get. I just provide it as a service to the patients. This is a patient who came in with a walking stick, hadn't been able to fish in 2 years. That was his favorite hobby, and he went back to fishing. He's one of my few that it just went away.
In the past,
And say what you want to say.
Well, from where I started from to where I am now, it's truly amazing. I never thought that I'd ever be able to see the way I'm seeing today, or ever again.
He's able to fold up the walking stick and put it in the pocket. So. And this is a patient who it went away completely, I think I mentioned, for 10 years until she had a shoulder injury.
Tell me,
She
right
got
now,
it in her
what
30s.
has been affecting your life? Right now, I feel like I've gone downhill, so I feel like it has pretty much, it's destroying my life, especially with my young age, and I feel like I can't go out and live my life the way I should be at this age.
So what percentage do you feel you have improved since your myectomy?
I feel I've done about an 80% improvement. I don't have the uncontrollable blinking like I did. I don't have the urge to blink. You know, I feel like my eyes are just opened up. I can, you know, I see clear. When I look in the mirror, I just look bright-eyed, and it just...
Like I said, she did really well. So no one has a perfect brain. We have to accept our faults, and what doesn't kill you makes you stronger. Like I said, if you have any questions later on, feel free to message me through my Instagram account. That's my handle at the bottom, the @Dr. Julie Woodward. And I think we're going to entertain a few more questions.